Crashing into dialysis. Bet that's a term you've never heard before, but crashing into dialysis creates huge unneeded costs in our healthcare system, and more importantly, creates a horrible patient experience. Quite honestly, it's one of the worst parts of kidney care in America. On today's episode, what is crashing into dialysis? What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor, and I'm here to break down health in a simple way. Now do me a favor, hit that like, share, and subscribe button. It'll really help me out. In the last few years, I've realized that in order to improve healthcare delivery in America, you have to improve the patient experience. Now, other industries have come to this realization before, where they've improved the experiences for their clients or users. Now, one of the worst aspects of this in healthcare is something called crashing into dialysis, which essentially means an unplanned dialysis start. Estimates and definitions vary, but this kind of starting of dialysis accounts for about 30 to 60% of all patients that start dialysis. Consider it like a baptism by fire. Now, to best explain it, let me go over what's actually supposed to happen. You as a patient are supposed to refer to me as a kidney doctor early on in your disease process. Typically kidney disease stage 3, when your kidney function gets below, say, 60% or so. Then you follow with me regularly every few months as I optimize medication, discuss lifestyle modification, and help balance all your comorbidities like diabetes and high blood pressure. During that time, you and I will develop a relationship, develop trust. Now, over the years, we can stabilize you, but occasionally a kidney function will continue to decline. Now, in that case, we slowly introduce concepts like kidney transplant and ask you about different forms of dialysis that you would prefer. Then, as your kidney function is coming close to needing dialysis, we get a surgeon to actually place a dialysis access in you, either in your arm or your belly. When you're ready, we like to initiate you on dialysis in a comfortable outpatient setting. Now, that's what we consider a optimal start. Now, what actually happens is much worse. You crash. That happens 30 to 60% of the time. Patients either have poor or no follow-up with the kidney doctor. You start to develop some symptoms like weakness, fatigue, nausea, vomiting, poor appetite, shortness of breath, or leg swelling. You show up in a doctor's office or a hospital ER, and after running some blood work on you, the doc comes up to you and he's like, "Hey man, your kidneys ain't working no more and you need to start dialysis." Then he quickly goes over the need to put a catheter, which is a tube in your neck, in order to clean your blood, in order to save your life at that moment. Then, after several days in the hospital, you find yourself to be a lifelong dialysis patient, needing to go to an outpatient clinic 3 times a week for 4-hour dialysis sessions. Yup, that's the kidney care experience in America for a large percentage of our patients. Now, key to combating this is earlier referral to kidney doctors, optimizing medications, better education, and honestly, better compliance with patients. If you found this video helpful, please like and share it. Oh, you got something to say? Please leave comments in the comment section below. And remember, it's your kidneys, your health.